All right, here we go. Welcome to another episode of the Non-Victimation Podcast. Today I have my guest Trever Wilkins, who is an ER doctor and has his own private practice. And I'm sorry, remind me the name again.
Optimized performance medicine.
Okay, I said that at least four times and I still can't remember it. But yeah, so and you were saying that that is kind of like the antithesis of like the ER, where that's like life and death, and this is not so much, but definitely pushing towards keeping people in a healthy state so that they're not having to end up here in the ER,
Exactly.
you
It's,
know?
it's it's like a yin and a yang,
Right.
as I see it. Yeah.
There you go. And so when you started into medicine, was that sort of the direction you always thought you would be going, or were you really kind of set on just being an ER doctor?
Yeah. I interestingly enough thought that I was going to go into family medicine.
Okay.
And so it's an interesting, time of your life when, you're making a lot of really big decisions
Hmm.
at a pretty young age.
Right.
So you're 22 or somewhere around that age. And the way that medicine is set up is you do, a lot of classroom work for about 2 years.
Hmm.
And then the last 2 years of medical school, you're spending a month doing every different rotation. And so I went in thinking I went into family medicine, but I went into surgery and I was like, I want to do surgery.
Right.
Every specialty was the same thing. I want to be a pediatrician, a gynecologist.
Yeah.
And at that time, emergency medicine, it really is a great specialty because
Hmm.
you're in this hospital setting and you have all these tools and you
Hmm.
do procedures and treatments and you get this immediate gratification of like,
Right.
wow, I made a difference. I shocked this person's heart and now they're
Right.
they're alive, or
Yeah.
this person wasn't breathing, I got them on life support, or
Hmm.
the list goes on and on. And so at that stage I was like, yeah, I see this, and it felt right then, and I still really do like it.
Right.
But just after a while, I was like, what, I'm missing something. I think medicine is missing something, and
Right.
so kind of created that kind of dichotomy that we discussed.
There you go. Um, and this is something we had talked about just before we started recording, that, there's the extreme nature of it. And like, so I've never been in that sort of situation. I've only ever like watched like shows and things like that where like you see the types of procedures and things they're going through. And in the back of my mind, I always thought that like, while I think that it would be wonderful to be a doctor, I don't think personally that I could do it, just because if I lost somebody, even through no fault of my own, that would be something that I think would be really hard to deal with. And I don't know that I could compartmentalize well enough to say, I'm just going to put that over here and I'm going to keep going. So I have to imagine that that's something that you deal with on some level.
Yeah, I mean, absolutely. And fortunately, those times where most of the time in the ER we're actually able to get most of the people at least stabilized.
Hmm.
I'm sure a lot of them go up to the floor in the intensive care unit
Right.
and expire. But yeah, absolutely. I mean, you see some really, really tough cases, kids getting hit by drunk drivers
Right.
and drownings, and you're people there with their loved ones. And yeah, it's absolutely challenging. And I think that the the thing that I've reflected back on
Hmm.
is you'll get in there and you'll run a code. Somebody's dying, and this is like a catastrophic event for this person, their family members. You spend 15 minutes, half hour, an hour, 2 hours in there. As soon as you get out,
Hmm.
you have 10 people that
Right.
are waiting to see you. And we don't ever really get taught like how to process that. I
Hmm.
mean, they make some attempts, and sometimes they'll have
Hmm.
some like a group meeting, kind of to process things. But yeah, you end up, it's hard not to take that home with you.
Hmm.
And at the same time, like another thing that we were talking about, when you have a duty
Hmm.
and you have a responsibility, you just have to say, all right, well,
Right.
on to the next. And
Hmm.
so that's the environment that the emergency department creates. So on the job, it's you're kind of like exhausted. And it's like you grind through it. You get home, you have to learn how to process that.
Right. So on the family side of that, I remember listening to a podcast with Jocko, and he was talking about, emergency doctors like having to give the bad information that the person has passed on, right?
Hmm.
And he talked about, the best way that you could do that is to be very succinct and just kind of say what you got to say, and then leave. You let the family deal with it however they're going to. And even that is something that I think would just be really hard to deal with. And like I said, I can I can intellectually sit here and say that yes, I could do that, you know, but that when it comes right down to it, just the emotional feeling of that and having to tell somebody that they've lost somebody, again, that just seems like it would be a lot to deal with. And I really applaud people that are able to do that because it is a big deal. It's not just a everyday, I came and punched in, did my job, and I went home and everything was the same the next day when I came back. You know,
Right.
it's a lot. So I often wonder, like the people that get into emergency medicine, how much of that is because they really feel like that's where they're needed or that's what they should be doing, and how much of it is, or how often, I guess, is the case where it's somebody who has that need for sort of like adrenaline, not in a dangerous sense, but they need to have that sort of constant state of emergency where they that allows them to perform the way that they do.
Yeah, it's interesting that you say that. Every specialty has a certain personality
Hmm.
to it.
Right.
And and so in initial I didn't realize how much, I think I do fit in with the emergency medicine.
Right.
And we kind of jokingly get accused, and maybe not jokingly, of
Right.
having ADHD. But I talked with a crisis counselor that was in the emergency department. We had a shared psychiatric patient,
Hmm.
and we were kind of joking around about that personality of emergency medicine physicians. And she said that that's actually a skill that attracts a lot of emergency medicine physicians because
Hmm.
it's a natural way to triage the most important um, uh, pressing issue at that
Hmm.
time. So, for example, if I'm talking to somebody about an ingrown toenail,
Right.
and comes a code is just like, that natural instinct of like, oh, okay, I'm kind of over this.
Yeah.
Let's go over here.
Right.
And so there's definitely that type of personality. And then the emergency medicine docs just tend to be able to just really like handle stress and chaotic
Hmm.
situations well. We kind of
Right.
accolade to a lot. You'll see a lot. I do jiu-jitsu and mountain biking and
Right.
like all that type of stuff. And it's just so there is that kind of adrenaline
Hmm.
um, component to it, but still it needs somebody that can just be like, okay, like I said, we
Right.
ran a code on to the next thing.
Yeah.
So I think that there's somewhat of a kind of a natural selection where you just kind of gravitate.
Right.
Like I was describing before, I went into family medicine, which would be great specialty, it really would.
Hmm.
Um, but when I was exposed to it, there's just like, okay, what is this? It's
Right.
kind of drawing me in with the choices that I had at that time.
Yeah. So, if you were talking to somebody that was getting ready to graduate from high school and you were giving them advice and that sort of thing, is it the sort of thing that you would say, this is definitely something you should look into? Would you give them some amount of caution about it? Or I guess, like, what would you say to them?
It's interesting because the I think about the advice that I got when I
Hmm.
was going in, and have actually July 1st will be 10 years since I finished residency that I'll be in it. So
Nice.
it like kind of snuck up on me that I'm like, oh, I feel a little tenured
Right.
with a decade under my belt. And they they were just kind of shaking their head. They're like, the medical system is not what it used to be.
Right.
Medicine is so different than it was. And so, I think that if you are going into medicine because you're like, hey, I can make a lot of money and
Hmm.
I can do this type of stuff, I think that there would be better avenues to
Hmm.
do it. But like if you're just like I love my job. I love both aspects of it.
Right.
I love at one point in time I kind of got burned out on emergency medicine. I thought, "Nah, I'm kind of done." And I had my private practice, and I was like, I miss it. I like and I actually wanted to get back into doing more of the higher acuity things. And it kind of took creating a little bit of space to be like, it's really, really cool job. Like
Right.
I love every day that I have. So if you go and you do some rounds with EMS and you're just kind of captivated, or you spend some time with, you know, just you want to pursue medicine, then absolutely, like it's cool, it's rewarding, and like I mean, like the patients are just so respectful. It's just like an honor to be in that position, and people express their gratitude is super super fulfilling. If you weren't into it, it would be a horrible job.
Right.
Because there's a lot that comes along with that, a lot of collateral
Yeah.
issues, difficult situations that
Hmm.
you're talking
Yeah.
about that you have to deal with. If you weren't into it, it'd be a
Hmm.
really really challenging situation.
Have you met people that kind of started with a really definite mindset that's the direction they wanted to go, and then just through their experiences, whatever, said, nope, this is not going to work?
Well, I think that there's definitely a lot of people that you start medical school and you're like, get into medical school, you're doing these medical missions, and you're
Hmm.
you're going to save the world,
Right.
and you're in medical school, and you're just you're bombarded with all of this you know this fire hydrant of information, and you're staying up all late at night and getting up early studying, and you're just like, I'm just going to get through, and then you finish, and you get thrown into the system,
Right.
and you have hospital administration telling you what to do, and you have the medical legal aspect of it, you have
Hmm.
challenging patients, and that type of thing. And then I think a lot of docs, experience that burnout,
Hmm.
and because the true essence of the medicine of just like
Hmm.
having that relationship, talking with the patient, gets overshadowed by, hey, insurance wants you to do this,
Right.
administration wants you to do that. And I think that most of the burnout and most of the people that deviate or want to leave medicine, I think it comes more so from those other kind of external factors.
Right.
I think that I think by and large, like um, most people in medicine, um, they seem to to I think deep down inside like it,
Hmm.
but you are seeing more, more people that are veering off in other directions.
Right.
Like um, I am gonna do some medical spa, or weight loss clinic,
Right.
concierge medicine, or something like that.
Yeah.
So, um, but I at the same time, they're staying in medicine. It's just
Hmm.
the delivery and the interaction that's,
Right.
I think, that most
Something where they have more influence over how it's being delivered.
mhm,
Yeah.
get out of the system a little bit.
Yeah. So I have that same sort of experience working for the Department of Corrections. The job itself, it is what it is, depending on what kind of unit you're on, what level the inmates are, it can be really extreme or really pretty casual, and even casual is not safe. There's
Fair
still
enough.
some amount of danger there, but it's definitely not level five, full maximum custody, but um, just in the time that I've been there, I've seen that same sort of thing, not just for myself, but talking to a lot of the officers that have been there for like 20 or more years sometimes, anywhere from about 10 to 15 years, they've got a pretty good uh, perspective about, how things were when they started. And just over that time, they're watching how the administration has changed, how uh, just the whole system, everything, how it's being run, and it never is going in the right direction. It always seems like it's
Mm,
going so far on the side of making sure that the inmates are being infantilized, and treated like they're the ones that matter more than the actual officers that are there to do the job, you know. And so it's getting harder for them to like just find people that even want to do the job, let alone stick out for that, long enough to retire.
mhm.
So now they're offering much bigger incentives. Like I think the last thing I saw was like $5,000 as a signing bonus to come on. You had to stay on for like X amount of time. And even with that, I imagine that there's a lot of people that are going to come in and take that money, and then just as soon as that time expires, they're done. You know,
Right.
um, so it's hard to look at any institution and say that the administration is doing a wonderful job of making it the sort of place that you want to be, and still be efficient in what they're doing.
100%. And in the emergency department, the administrators that do the best, that have the best reputations, are the ones that are in the trenches,
Right.
that are making those decisions based on, hey, I know what these people are experiencing uh, in the day to day type of things, and so I think a lot of that gets lost when you start looking at
Mhm.
spreadsheets and
Right.
quarterly reports
Yeah.
and that type of thing, um, and lose that perspective. But that is interesting that we share a common denominator
Hmm. Yeah.
with some big issues with what they're
Right.
dealing with.
Um, so one of the big things that I've noticed is that there's a lot of healthcare seems determined by insurance and what they want more so than what, what people want. One facet of that is that, they charge really high amounts of money for insurance, and they only cover certain things or whatever. The thing that seems to be lacking in that entire system is the preventative medicine. It's like they're never telling you like what you should be doing to stay healthy so you don't need the insurance. They focus on just trying to fix the problem after it's already broken. It's like, that's like running your car into the ground and then worrying about how to fix it rather than making sure that you do the tune-ups, make sure you rotate your tires, do all the things you're supposed to do, keep it going, right?
100%. And that's exactly what I was seeing in the emergency department.
Hmm.
The one example, um, fatty liver, right? We see abdominal pain all the time.
Hmm.
But I keep on seeing younger and younger people
Hmm.
that come in with what's going to end up be potentially debilitating. Think of like an alcohol cirrhotic liver.
Right.
Like in not too long, we're going to have more liver transplants from fatty livers than from alcohol itself, which is crazy. I
Yeah,
mean,
that is crazy.
yeah, and I was just seeing it all the time. That's one example of, these people are coming in a revolving door.
Hmm.
Hey, pain medicine, CT scan, see you later. Back
Right.
the next week. You
My
still have
hand.
the abdominal pain.
Yeah.
But we're so busy that we're not talking about this. And it's, once again, it's coming from the top. Like, what are you getting compensated for? What's gonna pay the bills at the end of the day? And
Mhm.
in the emergency room, it's gonna be a much different picture. But
Right.
even in the primary care center or setting, like there's not that focus. I mean,
Yeah.
it's crazy. And so that and other, just other facets where I'm just like thinking, like, from musculoskeletal to, the gastrointestinal, like everything, cardiovascular, neurologically, like the problems that I was seeing was I was trying to put a band-aid on something
Hmm.
that was already broken,
Right.
and creating practice where I could catch people early on. I mean, one example, I have this retired professional athlete, he's 48, and he's like he we get his blood work and we do other things, kind of some fine tuning, like nutritional things. And after a couple times, I'm looking at his cholesterol. I'm like you won't hear this anywhere. That bugs me. Like, what kind of family history do you have? Well, dad has heart attacks, blah blah blah.
Right.
I'm like, I'm gonna do a test that I'm gonna recommend you spend $100. It's gonna be a great investment on a coronary calcium score.
Hmm.
So despite this guy just be lean and mean, like just the picture of health,
Right.
he's with that small abnormality in his cholesterol.
Hmm.
He's already starting to form plaque
Right.
in his coronary vessels, which means in his brain for,
Right.
dementia, like everywhere.
Yeah.
Like, and those, so by being able to catch him
Hmm.
now and, like, be more aggressive than you would typically see, like that saves me from him coming in with a heart attack,
Hmm.
and heart failure in, 5 or 10 years, despite doing everything right. He just has bad genetics. So we can
Right.
intervene in a little bit more aggressive way. But that's one of those, the many examples of, he had to pay cash for that.
Right.
Insurance doesn't want to catch that. They would rather
Hmm.
do a cardiac catheterization that costs $10,000 when he's
Of course.
getting stents placed and
Right.
be on these different. I can't say that they'd rather do it, but that the way that it's set up,
Hmm.
that's what ends up happening. And And so it's been really rewarding. I've been doing this, probably 5 years thinking about it, and 4 years actually doing it. And
Right.
it's been so much work,
Hmm.
but professionally being able
Hmm.
to see that problem, and instead of just being frustrated and burned out, like having that outlet to actually create it despite all the, the extra work, and
Right.
you know the wife being upset that like, really, you're gonna build a practice after we already finished residency and
Right.
everything else. But but being able to answer that and have those interactions, have those
Hmm.
conversations with, I mean, that's one of like a lot of different um uh, patients, is rewarding, especially
Hmm.
for us physicians.
Right.
It's scary to get outside of medicine and start like, how do I open up, this whole, we don't have MBAs, to do this. And
Yeah.
so it's been it's been rewarding. It's been a ton of work to just kind of buck the system a little bit
Hmm.
and just be like, no, I'm not just going to be a cog.
Hmm.
Like I want to actually, you know, look back
Hmm.
and feel happy, even if it's, a ton of work and scary. Although
Right.
starting a business, starting a business and that type of thing. And so, that's my little part to be like, well, in hospitals aren't focusing on preventive, but you know what? I can, and I can have conversations with people, and people are understanding that. People are
Hmm.
fed up with the insurance
Right.
systems too, as they should be.
Right. Um, I don't want to idealize the 40s and 50s because there were problems then too, right? But at least on a broad scale, if you looked at most of the Americans in this country, they were reasonably fit. There were not a lot of overweight people, and they didn't have all the same health issues that we do now. And I attribute most of that to processed foods and things like that. That once those things were introduced, everything just sort of started to decline pretty rapidly, right? And the same thing with like removing physical education from schools. I watch like videos like from the 40s, like with kids doing exercises that most adults wouldn't do now, like running circuits and things like that. And it's amazing that to them that was just an everyday part of life. That's just what you did, right? It's like we've gotten so far away from that it's created its own set of issues, I think, that now the medical professions have to deal with, and some you may have a different opinion of this, but the it seems like the insurance companies sort of they're encouraging this or incentivizing this activity because that's how they make their money, you know?
Yeah, it's a difficult it's difficult for me to say, like, they're intentionally doing this, and they could be,
Hmm.
I don't know. But the way that it's set up,
Hmm.
it definitely does not address that. And the investment, of all the thousands of dollars that people are paying every year, like when we go to code something, like we can't just, code, like, this person's overweight. Like, to them, they
Right.
they will not pay a provider
Uh-huh.
to sit down and have a conversation to, like, hey, you're overweight. This is what you legitimately need to do. Like, they just want to kind of brush it on a
Yeah.
rug. And maybe there is something to it, because you look at the cost of insulin
Hmm.
in our country, especially. You can
Hmm.
go to, Canada and get it for a fraction of the price, which is
Yeah.
crazy. And like, this is like a, an important drug that's been around forever.
Hmm.
And so, I mean, the logistics behind it, I mean, there is a lot more money to be
Right.
made by various people by
Hmm.
having that. So it does make you,
Hmm.
question that, what is the thought process behind your decision making,
Hmm.
because it doesn't make sense the way
Right.
that it's set up right now.
So I know that at one point, and I don't know if this is still true or not, but the three leading causes of death were heart disease, diabetes, and I can't remember what the third one was. I want to say it was just general obesity, but
I mean, cancer is a big one. I don't know
yeah,
if it was up there, but
yeah. But at least two out of those three, they're like 100% preventable if you just take care of yourself and do the things you're supposed to be doing, not treating your body like a garbage bin and eating everything that you see, it's a gross exaggeration to say that, but there are a lot of people that eat tons of processed food. They drink tons of soda. They drink lots of, energy drinks, especially, you know, and I understand because I drink energy drinks too,
right.
you know, there's a time for that, but there are people that I know that can't go a day without drinking those things,
Mm.
and I have to imagine that that's contributing in a lot of ways, kind of like to the fatty liver and that sort of thing. And they don't, because they're not seeing it, even if they're not like gaining weight and things like that, it's something that is happening to them that they need to be addressing or at least need to be aware of.
Yeah, and it's been, over the last several decades, it's been just grossly neglected, and in the governing bodies that are giving recommendations have not, have not done a good job of really educating people on the importance of it, or what they need to do it, or even the right guidelines. And I think there, the pendulum is starting to swing back. I mean, just anecdotally,
Right.
I'm seeing that where people are starting to, learn that, like, yeah, I need to invest in myself,
Mhm.
which is really challenging,
Yeah.
in these circumstances. And I see it all the time. It's like, wait, I'm paying I have this benefit.
Hmm.
I'm still paying all this money
Hmm.
to insurance.
Right.
And, like that conversation I had, like, hey, you should get this coronary calcium score.
Hmm.
Insurance isn't going to cover it. Really? Pay all
Yeah.
this money, but or maybe doing a DEXA scan for your body composition, or VO2 max to look at, like, your like how healthy you are metabolically.
Hmm.
Those are all, like, these amazing, you know, uh, ways to really determine your health, or
Hmm.
make sure that you don't have any preventive issues that need to be addressed. And it's a big burden
Hmm.
that we're faced right now. But even despite, all the money that we're investing, that there's more and more people that get it, just like you're talking about
Hmm.
right now. I think that COVID's another good example of that,
Yeah.
right? Like, we spend all, however much money, billions of dollars,
Hmm.
this vaccine that now is, like, very, like,
Right.
shows that there were, like, a lot of really nasty side effects to it. Um, Maybe didn't give us the efficacy that was claimed.
Hmm.
Um, and, all the other efforts that went into it. What was it that people really needed?
Hmm.
To not be diabetic,
Right.
to not be overweight, and we failed on that miserably. And I think that it's pretty obvious, if that time, imagine if we would have put that time and resource
Hmm.
collectively, as from a community health standpoint,
Hmm.
and really tell people, get outside,
Right.
get that vitamin D exposure,
Right.
finally. But we did the exact opposite. And I think that people are just coming to realize, you know, I really need to take the initiative on
Hmm.
my own, and I need to find out from, people that maybe I wouldn't have, I can't rely on what's being told to me from,
Right.
whoever, the FDA,
Yeah.
or these different bodies. And I think we're seeing more and more of that from, different podcasts and the internet, and
Hmm.
and everything else. And I mean, and hopefully that is the case. I hope that people are
Hmm.
taking that initiative on
Hmm.
there, despite the unfavorable circumstances that were put in. Um, because, like I said, I don't, it's so much better to have a conversation early
Hmm.
than seeing them in the emergency department
Right.
when it's too late.
So speaking of COVID, like during the kind of the epicenter of that whole incident, were you seeing a lot of actual COVID cases, not just things that were labeled COVID?
Yeah, yeah, I mean, there was a lot of COVID. I mean,
Hmm.
for sure. And, we'd confirm the diagnosis with,
Hmm.
reliable tests, presumably
Right.
reliable.
Hmm.
I put confidence in it. And so we did see a lot of that. Um, but I also saw that, like, people would just, it was exaggerated.
Hmm.
Like, the just COVID was the epicenter of,
Hmm.
like, a lot of the diagnosis. That's about the extent that I saw, just anecdotally, with
Hmm.
with my experience. But what I also saw were the people that were getting admitted and being put on life support, like,
Hmm.
were the people that it was the comorbidities
Right.
more than anything else.
Hmm.
The overweight, diabetic,
Right.
etc.
So I know that there were a lot of cases where people were dying of things, not necessarily COVID, but they had COVID, so they labeled it as a COVID death, that kind of thing.
Yeah,
And I don't know how much of that was actively going on like everywhere in the country, or if it was just like in certain areas more so. Um,
yeah. I wish I could. I can't answer that better because fortunately, like kind of joke around like nobody's gonna die in my ER. So I,
right.
unfortunately,
Yeah.
I mean, even and like I said, like even um, back to our early conversation about those end of life discussions.
Mhm,
You know, most of the time, overwhelmingly, the majority of the time,
mhm.
people like we can put them on life support,
Right.
and then if they are going to expire, it'll be in the, let's say, the intensive care unit.
Right.
And so I didn't, I didn't sign any of those death certificates
Hmm.
because it was more like, hey, this person's life support or oxygen dependent, whatever the case may
Right.
be, and so I didn't see the the signing of the death certificate, so
Mhm.
I wouldn't be able to add any additional insight as far as that went,
Right.
other than, yeah, I mean, that COVID diagnosis
Hmm.
was used, just for
Yeah.
everything. It was the epicenter of, at that
Yeah.
time of, just the focus of everything. So I did see that.
Yeah. So, in like not too long after I started DOC, I actually had COVID. I went to work one day and I thought I was just tired because we were working 12-hour shifts. There was a lot of work, a lot of movement and things like that. And I thought I was just worn out. Turns out I had COVID. So they said, go get tested. And I did. And for me, the COVID was pretty extreme. It was a lot of body pain, a lot of like major congestion and that sort of thing. But after the 2 weeks went by, I was pretty much recovered. I was cleared by the OHN to come back to work and just went on. I know that that's not the case for everybody, uh, but I think that they did such a good job, that the media especially, like of hyping this thing up into, if you get COVID, you're going to die, you know, versus like saying, hey, these are the sort of things you could do to make sure you don't get COVID and not just staying inside your home. It's because,
Right.
that's not
Exactly.
a real solution.
Yeah,
But,
correct. Yeah.
and if you have COVID, just deal with it. It's going to run its course. And in most cases, unless you have comorbidities and other things that could be complications, most likely you're going to be fine, you know?
Yeah, and once again, I wish that opportunity would
Hmm.
have been there. Like with, I would look at it as like just great leadership
Hmm.
of instead of focusing on this fear of like, hey, like stay inside and like,
Hmm.
everybody like literally, I mean, like one thing we learned is like how social we are and like the
Yeah.
I mean, that was devastating for people just isolating themselves, and that's just such an important part of our health. And that became very clear, and just that like there was such that message of fear, and
Hmm.
and do this or you're not going to get that,
Right.
and instead of this opportunity of like, hey, what can you do today to be proactive
Right.
about it besides the fact, okay, you
Yeah.
guys are pushing the vaccine, okay, cool,
Hmm.
what else can we do? All right.
Yeah.
Or if you decided to get the vaccine, you got the vaccine. Okay, now what?
Right.
Like, is it, it was narrowed down to a mask and isolating yourself, and that, like, where was this opportunity to talk about the things that were very obvious,
Mhm. Right.
like exercise, eat right,
Right.
like,
Yeah.
find, like have a healthy lifestyle. Um, so yeah, I think it was, you know, looking back on it, it's always easy to be an armchair quarterback, but um, the message that was communicated was not nearly as helpful
Right.
as it could have been, and a lot of
Hmm.
times are
I, th-
detrimental.
I think that COVID was a major opportunity, a learning opportunity for this country overall. I think that because of the messaging and the way that it was handled or mishandled, um, we didn't benefit from it the way we probably could have. Just like you're saying,
No,
there was a way to like help people understand that if you don't want these sort of things to happen, maybe you should be doing a little bit more of this, kind of thing.
100%,
Yeah.
100%, and hopefully it's not too late,
Right.
because I guess it's not just COVID,
Right.
and like that's what I see. I mean, I just like in the ER, like, and and I'm grateful for this platform because it's
Mhm.
like I see that, like the occasion, you see the end of life issues, and more often the quality of life issues, like where people um, have abused their bodies or they haven't taken care of their bodies and now their health is gone. And it's like
Hmm.
life changes
Right.
big time, when that happens. And the other thing too that like why I like performance medicine,
Hmm.
and it's a very focus on what we call like athletically minded, which just
Hmm.
means that component of being proactive
Hmm.
and investing in yourself is when people have had things that happen just because we live on planet Earth, the
Right.
people that have to battle cancer, have to battle
Hmm.
big trauma, like by not just avoiding things and not doing bad things to your body, but
Hmm.
by investing in the exercise and being and having that resilience
Hmm.
and health, like those are the people that when they're going to overcome these emergency issues
Hmm.
way better,
Right.
and so anyways, I love the opportunity, and just to get that message out of like like get on the front end of it,
Right.
so you can be prepared. We're
Right.
all we're all gonna die, right? So
Right.
let's make sure that when we get to that point or any crises,
Hmm.
um, that we're prepared and
Right.
we're invested, because it's so much better to invest early on
Hmm.
instead of just trying to fix a problem.
Right. So maybe a different way to look at this is not so much of the extreme of like, uh, that sort of illness or like major health issues, even just simple things like bone density, your overall, your structural integrity, I guess is a good way to look at it. I remember many, many years ago, I worked for GNC. I was in a mall and I was right next to the entrance and I would watch people, all day just come and go. But I would see like older people that were coming in that were just like their spines were like curved, their heads were tilted down, things like that. It's like you can tell that like they probably had injuries and that sort of thing that probably helped facilitate some of that, right? But how much of it was just because they led a very sedentary life and just didn't do the things to make their body stronger that it could deal with whatever was coming, right? Um, so even aside from just like the most extreme things, just being able to like stand up and sit down by yourself when you're older, that's a major deal. Um, when older people they fall down, their bones break more easily because they lose their bone density and things like that. There again, if they were exercising and doing the things that they should have been doing like most of their lives, they'd probably be in better shape and not be so fragile. So,
100%. It's I was exercise science major in
mhm,
undergrad, and
right.
so we're learning about the cardiac output as an example.
Hmm.
But once you get to that, past your 20s essentially, or even the late 20s, you can calculate, for example, your cardiac output
Right.
and mathematically see this demise, of how well your heart functions.
Hmm.
And the same thing goes with your muscle structure and your bone structure. Like
Hmm.
it's a trajected path that's
Right.
like it's very obvious
Hmm.
that of what's going to happen. And I think that more of those structural changes that that
Hmm.
kyphosis where somebody's just kind of hunched over
Right.
is the body doing what we know it's going to do. We
Hmm.
know that the body is going to lose muscle mass, it's going to lose bone density, it's going to
Right.
your cardiac output is going to go down. Like you metabolically, you're at a cellular level. Things are not going to work as well as when you're younger. Your hormones are going down every
Right.
every year. And so 100%, what can you do about it?
Hmm.
You, like I said, it's inevitable. We're all going to
Right.
die,
Right.
but you can get to that point and function so much better.
Hmm.
And the thing that I love about about being a physician, having my practice, is we can take really cool innovation that's getting ignored by
Right.
conventional medicine.
Right.
So that's fine. Like we'll take it. And you can and we can, in addition to the most important things, which is lifestyle and nutrition,
Hmm.
but we can use really cool medicine and techniques and modalities
Hmm.
to get this really clear picture, get these awesome treatments. It can be, intravenous, oral, it could be pharmaceuticals. I mean, we can take all of these things that are available to us
Hmm.
and find a way that when we're in the latter decades of our life,
Hmm.
we can be doing what we want, and I would say even more importantly, like still contributing to society, which I hope we all want to continue doing,
Right.
till the very end. And um, and so that investment, now once again, I think is going to prevent what you were observing,
Uh-huh.
watching those people.
Right.
That's what happens
Yeah.
naturally. So you need to be smart about it. And I love I love having the tools as a physician to to kind of augment those efforts.
Right. So not long after I had that job working at GNC, I actually went to school to become a massage therapist.
Hmm.
So went through, just the really early stages of like medicine, of like understanding bones, the muscles, all the connective tissues, like, everything and how that works, right? And that's where a lot of that thought process comes from. It's like over time, that's going to degrade if you don't do something to keep it going, you know? And so again, I just kind of mentally made this agreement with myself. It's like, I'm not ever going to be that guy. I'm not ever going to be, with one of those walkers, I don't, if I live to be 120, I want to be strong enough to stand upright, to be able to sit down, stand up on my own, and do all the things that a normal function, without having those kind of problems. So,
100%. And I think that that's good foresight.
mhm,
And I don't think that enough people really think about that.
yeah,
And once again, I see it all the time in the emergency department, like, geriatrics. You have the end of life issues, and talking to these people, and they have, this week I saw somebody, they had four cancers at the same time. I was like, wow, but that they're the same person,
yeah,
and they want to feel as well as we did when we were, you
mhm,
know, a teenager or 20 or 30 or 40.
right,
It doesn't really change. Like I've seen like people that, like having once again having those discussions. It's like, hey, you're 95. You you got this. You're going to the ICU if you want to continue. And they're like, yeah, I want let's just do it. I'm like, all right, cool. Whatever you want. But like, but that's not. We kind of forget about our future.
right,
120-year-old self, and that
yeah,
120-year-old self is going to be wanting to do the same things that we're doing
yeah,
right now.
uh,
The
right,
same hobbies, the same social
yeah,
interactions, and so that, like I said, like I hope, as an ER doc, it's like,
right,
think about it. You got it right
yeah,
now, because it's so important, and it's inevitably going to come, and you're going to be so thankful
mhm,
for that investment
right,
now. It's going to be exponentially,
yeah,
you're going to get an exponential return on that investment.
right. I read something a long time ago, and this thought kind of sticks in my head. It's like the future you is always watching you, you know, always seeing what you're doing right now. And you have to wonder what that version of yourself is thinking about what you're
Right?
doing right now, you know? Um, so with all of that, like in your own practice, how much of that do you focus on kind of those things versus just kind of like dealing with the issues and things that they've got?
It's all forward thinking,
Hmm.
with it. Um, and it takes the right, patient that wants, that want, you gotta, you first of all, you need to want that. And the pillars of the practice really are the, you know the exercise and the
Hmm.
nutrition. But in addition to that, like, we have the resources to look at it much more, scientifically,
Hmm.
and with the innovations that we have right now, where, everything that we're doing, we're addressing immediate problems.
Right,
But, like injuries and
right.
that type of thing, we'll you know keep we one of the huge things that we do is keep people, out of the operating room, because a lot of the stem cell procedures that we do can
Hmm.
can um, can prevent people and get better outcomes
Hmm.
with that. Um, and uh, but, additionally, we're fixing those problems, but we're looking at, like, hey, like, how, we do a lot of hormone optimization,
Hmm.
especially, once again, is it's inevitable that that's
Right.
going to decline. And so,
Hmm.
we start from the beginning, like, what are you doing? Are you getting enough, strength training? What's your diet like? What's your stress level like? What's your sleep like?
Hmm.
And so that. that really is the focus in the practice, is getting yourself to a state where we're not just reflexively treating pathology,
Hmm.
but we're getting ourselves at this performance state, physiologically, even
Right.
if we're not athletically competing, where you're functioning at the highest levels,
Hmm.
that you're going to not have room for disease. And if you do have disease, you're really at an optimal level. And
Hmm.
that's the crux of
Right.
what we're doing. We're trying to stay ahead of all of this.
Okay. So for people that aren't familiar with like stem cell, um, could you explain a little bit of that?
Yeah, so there's um, like a spectrum
Hmm.
of use, and it's kind of, and I'm glad that you asked, because there's a lot of ambiguity
Hmm.
with it. And so, stem cells are found in a couple different places. So, embryologically, a lot
Hmm.
of people think about that. And then in the placenta, in the, amniotic cord, the stem cells are a very important part early in life. But we also maintain stem cells, and they're in, bone marrow
Hmm.
and fat. Those are the ones that we primarily focus on. And then even in your blood, you have different factors, like healing factors, that can recruit those,
Hmm.
the stem cells from your bone marrow.
Okay.
And so the options are, you have kind of this quick and relatively affordable option where you can take your own blood,
Hmm.
and it's called platelet rich plasma therapy, and you get rid of the stuff that you don't need for healing,
Hmm.
and you can inject it into an injured part, and those healing factors start to signal the stem cells to come. So you get this great, all these benefits
Hmm.
of regeneration of tissue, and you have these healing factors and anti-inflammatory
Hmm.
factors. um, you can take it a step further, and harvest your own stem cells. So you can tap into your bone marrow pretty easily, like in
Hmm.
the pelvis, and you take the bone marrow, and you put it, wherever you have an injury. If you have, arthritis and you don't have any cartilage,
Hmm.
or a tendon that was torn, like those can go and recognize that. We do, with our stem cells, we do a lot of adipose, and there's a specific, it's easier to access,
Hmm.
and it has the tissue itself, the fat tissue. When you're dealing with musculoskeletal,
Hmm.
it's almost like a scaffolding. And so we can, with ultrasound, let's say you tear your rotator cuff,
Hmm.
we can look where that tear is and almost putty it together, and that the stem cells in the adipose, or the fat cells,
Hmm.
you get it from the back, um, the lower back, kind of like looks like you're doing liposuction, and it has what's called mesenchymal cells,
Hmm.
and those cells can transform into whatever tissue you're at. So
Okay.
you you know these surgeons will get, or excuse me, radiologists will read these reports,
Hmm.
pre and a year post procedure, and they think that a cadaver lab's been placed, because the tissue will actually
Wow.
regenerate itself. It's really cool stuff.
That's really cool.
Yeah, yeah, for sure. And then you have the option where you can, get placental cells, or
Hmm.
and you can, that's taking it from not your own body but somewhere else, and,
Hmm.
and injecting. You get a
Right.
similar procedure. So that's the spectrum of it. And then, out of the country, they'll harvest stem cells, and then they'll actually reproduce them and get these really high count numbers. But
Hmm.
that's definitely a no in the
Hmm.
United States. So that's kind of the overview of stem cells.
So is it not something they don't do here in the country because that is a dangerous thing to try to like increase, like, okay, so exactly what do they do? They take the stem cells, and then you said that they increase the
Like in a
number.
lab,
Right.
they'll reproduce those cells.
Reproduce.
So they'll take whatever,
Uh-huh.
10,000, and create millions of them.
Okay.
So yeah,
So
so
is it that process that's a
that's a
no-no,
definite
or?
no. Yeah, I mean, and the FDA,
Hmm.
um, it plays an interesting role. And so once again, when we're talking about conventional medicine versus, that
Hmm.
patient physician
Right.
relationship, the FDA, there's a time and a place
Hmm.
for them. But with some of these procedures, like let's use PRP for an
Hmm.
example. Like, I mean, it's your own blood.
Right.
It's like it is assuming that you're doing using, hospital standard techniques and lab
Hmm.
techniques to
Right.
do it safely. I mean, it's hard to find a safer medicine than your
Hmm.
own blood.
Yeah.
And they, they will make a fuss about it because it hasn't gone through this process that costs
Right.
millions of dollars,
Yeah.
maybe $1 billion to go through. And the same thing with, it took me years to really wait and have the FDA like
Hmm.
not be like super antagonistic about
Hmm.
even doing stem cells. Once again, from your own body,
Right.
because they made a fuss. Well, it's not studied, it's not validated, and so those have been those have been challenging enough even in the United States where that's where Kobe Bryant and these different
Hmm.
NBA players or professional athletes were having to go to Germany to do this a while ago, and
Right.
so it's finally improving to the point where even Medicare will reimburse with like a non-healed uh, wound, like an
Hmm.
ulcer, like a bed sore of sorts, where you can inject, you'll have an ulcer for years, and then you start injecting with PRP and it starts healing. It's like, how do you argue
Right.
that?
Right.
And so they're like, sure, we'll reimburse for that.
Yeah.
Um, but it's the FDA's been very antagonistic
Hmm.
with this whole process. Where at one point you want to be thoughtful and
Right.
make sure that you're not doing any harm. At the same time, like it's been a
Hmm.
little overboard. And so it's eased up somewhat,
Hmm.
where it's becoming more it's being done more routinely, where even surgeons are starting to do this in the operating room. Some of the more forward thinking ones.
Hmm.
But once again, where they're actually replicating the cells,
Right.
that's I don't know if that will ever
Hmm.
be done in the United
Yeah.
States. Like,
Yeah. I was just wondering, like what part of that is it that they don't allow, and if there's a reason, I guess, why they're so against it. But that's.
yeah, it seems like the argument
Hmm.
that I've seen with that, and then something like peptides is another argument. Is there's well, we just don't know enough about it.
Hmm.
We can't endorse this. Unfortunately, to find out what you really need, I mean, you're talking
Right.
big bucks.
Yeah.
So it kind of like, well, it makes you wonder like
Hmm.
how those decisions are being made sometimes.
Right. Yeah. That's a whole other conversation.
Right, right. It is. It is.
Um, yeah. So like in the practice that you have now, are there things that you haven't done yet that you kind of like want to incorporate or kind of move into as you grow?
Yeah, absolutely. And that's what I love about it is having the autonomy.
Hmm.
Um, that once again it was a lot of work, and us physicians, we kind of it's
Yeah.
kind of hard to break away from that conventional mode or model. And um but having this platform
Hmm.
where we can really think about like what is the most effective treatment, because conventional medicine is oftentimes like decades behind.
Right.
You get these awesome technology. I mean, PRP and stem cells is a great example. I think in the future this will be utilized all the time because it
Hmm.
just makes so much sense.
Right.
And but yeah, we absolutely want to expand, and we're looking at, like even, exosomes are a part of, they're kind of in that the stem cell category. They're a component of blood that has this really important regenerative component. And
Hmm.
even, there's questions about, if there's value um, using those intravenously or stem cells intravenously, just kind of more of a collective standpoint. And so we're, you know, we're very thoughtful about doing procedures that are safe and effective, and that we're not taking on any unnecessary risks that
Hmm.
we'd want to put the patients in. But yeah, there's a lot of other treatments that are always coming out, that we continue to expand anything that we can see that is effective and
Right.
and safe and makes sense.
So if you could just wave a magic wand and say, this is where I'd like to see the medical, not just your own practice, but just the medical community in general go, like what sort of changes would you make?
But once again, is kind of funny because it's getting back to the basics,
Hmm.
right? Where we're communicating the importance to the patient of health. We're getting rid of the external factors
Hmm.
where medical providers have time
Hmm.
to sit down and talk with a patient
Right.
and really have that interaction
Hmm.
without all the other external pressures.
Right.
Um, and I mean, general generally speaking, like it's really if we had those things
Hmm.
and the you know I would love to see money not get wasted.
Right.
Is so like by the time we're spending so much money on insurance
Hmm.
and these protocols that that don't make sense with like these high costs that are happening in the hospital that we could be doing in an outpatient at a much lower price if we could take the money that we're spending collectively and that
Right.
individuals are spending and reallocate that into a much more efficient
Hmm.
system. Like, I mean, that's that's what I want to see.
Hmm.
Just want to see some common sense in
Yeah,
this.
that would be wonderful.
Right.
Yeah.
But because our country invests so much into it.
Hmm.
Even with what the budget of the government
Hmm.
spends so much money
Right.
and it's not efficient and we're not we're not as healthy as we should be.
Right. So just on the subject of like, I guess like new or emerging technologies and that sort of thing, where is the US kind of compared to like other countries?
Yeah,
Would you say that we're still kind of at the
I
front
think
end,
that
or are we starting to fall behind, or?
yeah, I think that's that's an interesting question that I don't feel super well versed with what other countries are
Hmm.
doing. I think that we're still forerunners. I think that
Right.
like the medicine, the innovations
Hmm.
are here. And I mean, I don't, but I'll say this. I don't feel like anybody's like has better medicine
Right.
than we do. But I think that other countries are, they practice good medicine.
Hmm.
And I think that if you looked internationally, I think that there would be, very similar where, everything's emerged to,
Hmm.
evidence-based
Right.
medicine. Um, and, there's a lot of really smart medical
Right.
providers out there. I think that the United States, can stand toe to toe as far as, how,
Right.
our, how we're, how the providers are treating medicine.
Hmm.
As far as, you know, delivery and that type of thing, how other countries are doing, I'm not sure.
Hmm.
Is a good question.
Yeah. Thanks. I just the reason why I thought of that is because I know that a lot of times people will go to other countries to have procedures and things done that they either can't get done here or that they just can't afford here. And I wasn't sure how much of that played into whether they're actually evolving or advancing in medicine faster, or if it's just kind of breaking down to those two things.
The way that I would see that, just once again, anecdotally,
Hmm.
is I think other countries have caught up.
Hmm.
Like we used to be the forerunner with a lot of this, and still you can go down and get treatments, but I don't think that the treatments are superior. I think that the treatments are affordable,
Right.
and
There you
that's
go.
once again like coming back to our conversation earlier.
Hmm.
Um, it's it shouldn't be like with how much we invest, and it's not because the doctors are getting paid exorbitant amounts. I mean, it's
Right.
crazy.
Hmm.
The reimbursement for physicians is not where the insurance is going at all. It
Yeah.
keeps going down
Hmm.
actually. And so going back to your original question, that's why I just wish we could just like I feel like if we just like started from scratch,
Right.
and it's like here's what you're going to invest in your health
Yeah.
and this is what you're going to pay your provider, choose your provider and just keep it that simple. I think
Right.
that we would we would see, you know, a healthcare system that made a lot more sense,
Hmm.
where, that's what they're doing when they go to another country.
Right.
Like, hey, you're gonna pay this person cash because they have a great service. They've
Hmm.
hopefully you've vetted them out. I mean, and you know that they have a good product.
Hmm.
Um, and yeah, it's really sad that we feel compelled to do that here in the
Right.
United States, or we're in a
Yeah.
position where a lot of people are doing it.
Hmm. There you go. Um, there's just so much that goes into that, and I'm trying to keep this from being a political conversation. But when I hear about insurance, it sounds very much like taxes. It's like it's collected from everybody, and there's like this huge bureaucracy of unelected officials that are in control of where that money goes, and none of that is up to us, you know? And that seems like the wrong way to be dealing with that because who knows where that money's going? It's largely unaccounted for, and it's obviously not going where it should be going. So, but
And my understanding is these insurance companies are having, you know, great years, you know,
yeah,
financially, you know,
right.
and so there's definitely a lot of the money that's going there, but like, I mean, it's so frustrating when, you know, I just see it every day. I mean, I see it personally,
Right.
you know, where you're a significant amount of your money
Hmm.
is going to pay for medical care, and then when you need it, you are still responsible for so much of it,
Hmm.
and um and and it's in there is a lot of that money that's getting squandered. I mean, here's an example that like some insight that like I have to share all the time, because once again we'll do a lot of expanded blood tests, you know, so
Hmm.
we're just like, hey, this isn't just going to be a couple, but we're really looking at, you know, nutrition and hormones and like, you know,
Hmm.
all these different factors. And a somebody uses their insurance and the insurance says, well, oh gosh, we don't need to worry about these, you know, these different things. There'll be a set price
Uh-huh.
that's way higher than what a cash price is. So like you'll go to you know, a
Right.
certain lab, like there's a
Hmm.
couple big ones, and so let's say, you know, this test costs, you know, $50. Well, they might charge $300 through insurance.
Right.
So if you just pay cash, it's a certain much lower affordable price. Well, let's say insurance doesn't want to cover that. You're still charged. They don't say, okay, pay the cash price. They say, no, you're still going to pay this like sometimes 10 times as much
Yeah.
amount. And you're just like, how does this make sense?
Right.
You know, like it's one of that's a small example of one of those things where insurance, you're just like, it's so inefficient and so unfair and
Right.
just doesn't make sense. And it's like that's why I say like just like you just wish you could just like, hey, just scratch it,
Yeah.
you know,
Let's start over.
find somebody that's providing a great service at a, you know,
Yeah.
at a quality, just good old, you know, capitalism at its finest,
Yeah.
and somebody that's performing well. Um, because yeah, I agree with you with the insurance. There's just so much money that's wasted,
Hmm.
and we suffer from it
Right.
as patients.
So, in your own practice, do you have any like a case example that was like that you're like really proud of, like kind of like where they started and where they ended, like how they?
Yeah, yeah. Like we had it's so funny. We had this guy, and he's in his 80s,
Okay.
and he was referred to us um to do so one of the things that I'll do with like severe pain is ketamine, IV ketamine treatment,
Okay.
which is a medicine that you need to respect. And I
Oh
use it
yeah.
in the emergency department, and so you know have the ability to do it in the office as well. So sometimes somebody have these debilitating injuries, like well, we'll
Mhm.
get referrals, um, and be able to administer that in the office. And so he came to us, and but he's just once again he's an athletically minded person. He could barely walk. He's like, all I want to do is go and golf, and he has this like
Yeah.
his wife, and so we're like, hey, you know, we can let's you know let's we can help out with that. And then you know as we got to know him, you know we said, hey, you know, we can help you out with this like exercise routine too. You know, I'm a DO, so we do hands on
Mhm.
training. We have a trainer in there, so he's in there doing that. And then all of a sudden we're looking at some of more of his health, you know, looking more at these preventive things. He has this whole long list of comorbidities with heart issues and these type of things. And so
Right.
now we're running this expanded panel, and we end up getting him on the whole regiment where he's training with us, and we actually got his hormones optimized, which in the medical world, like you're doing what to an 80-year-old? this, so he'll go to his other specialists.
Right.
The specialists are like, we hate this, but this guy feels so good and he
Right.
looks so different. Just let's work together on this. And
Right.
I've had a couple different specialists that have called me, and it's been super validating. So once again, this guy that's in the last stage of his life, to be able to see him, crawling in, like just couldn't sit on the table, to just vibrant, his muscle mass is stronger. He's out golfing,
Nice.
he's spending time with his kids, and he just, it's just this whole package where we've been able to really change this life. And he's like a good friend. We just love it when he comes in for,
Right.
the office for different things. So, but he's one of the examples, but a long list of people like that.
That's awesome.
Hmm.
That's a good thing to hear.
Yeah. Yeah,
Uh,
for sure.
right on. Do you have kids?
Yeah, I have 5 kids.
Awesome.
Yeah.
So this is one of the things we typically ask people towards the end of the interview. Like, what's your best dad advice?
Oh, that's a good question. You know, um, so my oldest is 17, and my youngest is 8, but you know, it's simple. To be patient.
Okay.
Yeah. It's just as simple as that. I look back, and I have these 5 amazing kids, and they're all just, I'm so proud of them.
Hmm.
But I look back on the things that I really, my wife and I both have, like, we expect, the kids
Right.
to to work and to do hard. But looking back, I I I think that I could have done the same thing, um, and just a lot more patiently,
Hmm.
and just enjoyed the process a lot more.
There you go. Journey before destination.
Right.
Awesome. Well,
Yeah.
I greatly appreciate you making the time to come in and speak with me.
Yeah, absolutely.
It's really interesting to like learn about what you do, like a little bit more in depth, because I know we had talked previously, like just on the phone.
Yeah.
Um, this is really good information that I think people can use.
Awesome.
So in the future, like, what's the best way for people to actually find you?
Oh, yeah. We, an easy Google search, optimized performance medicine. Our office is in Chandler, really close to downtown Alma School and Fry. So we're
Okay.
right between downtown Chandler and Chandler Regional Medical Center. But hopefully we're easy to find. We have a website that has some pretty good information on it, and we typically pop up if with optimized performance medicine
Okay.
search.
There you go. So I'll make sure that I include that in like
Thank
one of
you.
the show notes and everything and put the links for everything. But again, it was great to have you here. I definitely want to be respectful of your time. And yeah, thanks. I appreciate it.
Yeah,
And
thank you.
when you see Heston again, tell him I said thanks again for referring you in here.
Oh, absolutely, absolutely.
All right. Well, there you go. Bye, everybody. Thank you for listening. And if you enjoyed this episode, don't forget to like, share, and subscribe. Also, you can now support the Non-Victim Nation by donating via listener support directly on Spotify. Remember, the story of your life is being written right now, and you are the hero.